Welcome to another episode of Ask the Healthcare Advocate Live, where every Sunday, usually between 8:30 and 9, I review all things healthcare advocate related in navigation of healthcare, also in Israel and also abroad. Today I'm doing it a bit earlier. I wanted to get things started before the day gets busy. I wanted to share with you a personal advocacy story that I had. Just to show you, that we all have to go through, we all have to do it. And it's those little things that can really actually help you get things done and accomplished in a much easier way when you kind of know the few tricks. So I got my booster on Friday, my COVID-19 booster. That's why I'm still a little bit groggy. And thank goodness it wasn't like the reaction I had to the second one. I didn't get a fever, but still, it puts you under the weather a little bit for a couple of days. So we went and we took my mother to get her booster, as well as her carer who lives with her and also needed the booster. Now, back in the beginning, when everybody was getting the vaccines, you know how it was. I don't know how it was for you guys if you don't live in Israel, but in Israel, it was everybody was getting it at the same time. It was sort of a mass push, and we really wanted to get my parents vaccinated because we knew that these things were that they were in a high risk age group. And also, though, it made sense for my mother's carer to get a vaccine because she was the one who was with her all the time, and if she were exposed, she could expose my mother. In the very beginning, they weren't giving vaccines to carers, and that seemed a bit odd. But then after a few weeks, the government made a policy whereas if the carer came with the worker, they could also get the vaccine. Now, the carer and my mother don't have the same Kupat Cholim, and the Kupat Cholim was not paying for, the Kupat Cholim, the private health insurance that the carer has was not paying for the vaccine because these vaccines are quite expensive. So we took the carer with my mother, and you have to fill out a form, okay? You fill out a form in handwriting, and then they said, okay, and now you've got the shots. Now, in retrospect, we should have just taken a picture of the form or a photocopy or something, didn't think about that. But in the moment, it's going to be in the computer, it's no problem, et cetera, et cetera, et cetera. So this is how things go sometimes in the moment of crisis. Things are done that afterwards have to be evaluated in the light of regular protocol, and sometimes there's a big disconnect. Come however many months later, now we have to get the booster. I call up the Maccabi, the regular number. They said, of course, take your mother to get the booster, and the worker can get the booster at the same time. So we get there, of course, in a different clinic, because the first time when we went to the clinic, it was far away because those were the only people who had vaccines at that time. So we get to the clinic and they say, oh, no, she's not in the computer. Now here's the crossroads. So they say at the staff, oh, no, you have to go to Modi'in. You have to go to a different city in order to get the paperwork. Now, I have many clients, especially my very polite British clients, who would hear, oh, you have to go. And they would say, oh, okay, that is the protocol. I must have to go back to that office in Modi'in. Stop. Here it is. First of all, you are living in an area of no protocol. This is a very unclear process. Nobody knows. So the fact that the people said that wasn't because they knew definitively that we had to go to Modi'in. It's because they didn't want to handle it, because they didn't really know how to handle it, because it's unclear. She got the shot in Modi'in, so that's where you have to go, in Modi'in. However, I knew that wasn't going to help us, because it wasn't like Modi'in was so organized. It wasn't like I knew they could find the paperwork. Plus, we're not treated there. So they'll get there and they'll say, lady, I don't know what you're talking about. And then what am I supposed to do? Take my mother all the way over to Modi'in with the care? Of course not. I'm not going to schlep my 87-year-old mother in a wheelchair over to the office so that I would only go with the worker, who I'm sure they'd say, oh, no, we can't even give you the shot. Even if they could find the paper, we couldn't give her the shot without your mother. So I knew all this. And I said to myself, no, I need to stay here in this area. So what do? You have to reverse the situation, and you have to make the people of the staff recognize that this is in fact their responsibility. So I said, oh, no. Very nicely, very, very with manners. You don't have to be rude. And they weren't being rude either. There's no reason to be rude. and there's no reason to be angry or aggressive. I said, no, and Modine, I don't even know if they know where the paper is, and that's not our clinic. Then, of course, they said, why did you get the shot here? I said, because they didn't have the shots here back at that time, back when we were in the Wild West, and everybody was just giving everybody else vaccines however they could. So I said, no, this is an internal Maccabi issue, and you really need to figure out when she got the shot, etc. So therefore, you put it back, the responsibility back on the staff, and you remove yourself. You say, I'm here, I'm waiting. Thank you so much. We're good. You keep going. We're here. We're waiting. And there's just a few more iterations of, oh, maybe you should come back. No, thank you. Oh, maybe you should call this thing. No, thank you. Finally, after 45 minutes, the carer had her shot. We had a piece of paper that said the information about all 3 shots. Now, it's not over. I'm sure that to get her green pass will be another level of discussion. But the fact here remains is that you cannot accept the no, which I say in all my presentations. No is just the beginning of the conversation. And here it wasn't a no. It was, well, it's your responsibility. But it is not. And this is what I want to tell you. Anytime it comes to paperwork or bureaucracy in terms of what has been done and not done, you have to remind yourself it's not your job. It's not your job. Your job is to facilitate, but your job is for sure not to find the internal documents or figure out or communicate for the offices for each other. Now, sometimes you have no choice, unfortunately, but your first step should always be to get the offices to communicate with each other, and you step back and you say, I'm just waiting here for the answer when you have the internal conversation. So that's what I wanted to share with you, my own personal health advocacy story. I think it is very representative of so many different things that happen to people now in terms of this complicated healthcare system. Thank you so much for joining me as I do this Ask the Healthcare Advocate every Sunday on Facebook Live. Feel free to send me a private message if you've got a question. Feel free to check out my website, healthadvice.com. Got lots of really important information there. And feel free to check out all my other videos on Facebook, which give you, I think, a good explanation of different things to know in the system going forward. So thanks so much for joining us, and I will see you next week.